All right, anatomy of the ovary. So I'm gonna be using the ovary model as well as this primary follicle, which is just bigger, mature follicle, and ovulating follicle. Okay. So we have our ovarian mesothelium, our primordial follicles. Primordial follicles become primary follicles, which are these. Then we have our secondary follicle, which is your, so this would be your secondary. Secondary follicles have already developed a little bit of the antrum. So secondary, primary. Primary, you can see, doesn't really have an antrum. When I'm saying antrum, I'm talking about this buddy here. This would be your mature follicle here, which on the mature follicle, the antrum is huge. Okay, we have our ovulating follicle here. So the antrum is huge, and we have our ovulation about to happen. So I'm going to show you on this follicle right here, which is the secondary, the parts of the actual follicle. So we have the theca, which there's two parts to the theca, which is external and internal, but this is all theca. We have the granulosa cells, which are here. These are granulosa cells. We have the antrum, of course. The corona radiata, which is the crown of cells around the oocyte. So this is our oocyte. Then we have the zona pellucida here. And let's see what else we need to find on here. So on our ovary, our actual ovary, we have the cortex, which is all this region here. The cortex is where you'll find your follicles. The medulla would be here. We have, I don't know if I already said this, but ovarian mesothelium, tunica albuginea, which is just this layer here. We have so I guess I should clarify, these structures here are follicles, just at different stages, right? So along with the ovary, we have the corpus hemorrhagicum. Corpus hemorrhagicum. So after the follicle ovulates, it turns into the corpus hemorrhagicum. So the corpus hemorrhagicum fills with blood and blood clots, and then eventually becomes our corpus luteum here. The corpus luteum then turns into the corpus albicans. You can see corpus albicans here too. Corpus albicans eventually turns into scar tissue. Okay, so that covers it for our ovarian anatomy.